So first thing first, I'll put on gloves and identify the patient's name and date of birth to make sure we have the right patient before we do the assessment. So first, we'll gently palpate the breast. If you feel noodles in the breast, the ducts might not have been empty at last. And stroke downward to the nipples, then gently release the milk by natural. If noodle remain, notify the doctors. Take this opportunity to explain the process of milk production, what to do about engorgement, how to perform self-breast examinations, and answer any questions she may have about breastfeeding. And of course, what we look at is what is the contour. Are the breasts full, firm, tender, shiny? Are the veins distended? Is the skin warm? Feel the patient as if the patient complain about sore nipples. And then go down to uterus. We palpate the uterus. Have the patient feel her uterus as me explaining the process of innovations. If the uterus is not involving properly, check the infections, fibroids, and lack of tone. Uterus should be firm, decrease approximately 1 finger's breadth below. And then move on to the bladder. Inspect and palpate the bladder simultaneously while checking the height of the fundus. An order of the physician is made necessary for catheterization may be done. An order for culture and sensitivity tests since definitive treatment may be required. And then we'll tell her a proper perineal care, explain what she should wipe front to the back after voiding and defecating. Bowel functions and bowel, well, of course, with any assessment we have to listen for bowel sounds from clockwise, so to left, right, down to left. And then question asking patients about bowel movement daily, and she must not become constipated if her bowels have not functioned by the second postpartum day. The doctor may start her on a mild laxative. And the patient, she cannot go home unless she have a bowel movement. And for lochia, inform the mother that about change she should expect in lochia when it comes to keys. And I'll tell the mother that her next menstrual period will probably begin and she can resume sexual relation. And also I'll discuss family planning at this time. And I'll notify the doctor if the lochia look abnormal in color, or contain clot or other small ones. Episiotomy. So I'll inspect the episiotomy thoroughly using a flashlight with necessary for better look. And I'll check the rectal area if hemorrhoids are present, and check for proper wound healing, infections, inflammation, and suture sloughing if the surrounding skin is warm to touch. And then for the hormone sign, I'll press gently down on the patient's knee and flex the flat of the bed. Ask her to flex the foot. And pain or tenderness in the calf is a positive human sign and indicate thrombolysis. And for emotion status, through the physician assessment and notice and evaluation mother emotional status, I'll explain to the mother that her family that she may cry easily for a while, that her emotion may shift from high to low. The changes are normal and are probably caused by tremendous hormonal change occurring in her body, by her realizations of new responsibility that accompany of each childbirth. And I'll look to see if the patient appeared defendant or independent. Is she elated or despondent? And I'll ask her what does she say about family? What are other nonverbal response? And look for those kind of mental status.